Another interesting dissection. I wanted to share with you the tag on this heart and lungs. This specific specimen is from 1976. So I'm not going to show you the rest of the tag. It has the identifying number on it. This is the front of the heart and lungs. And interestingly, it has the trachea attached. So this is the diaphragmatic surface of the heart here. This is the anterior surface of the heart. And this is the posterior surface of the heart. So the first thing I want to do is to look at the atria and the atrial appendages. And so here is an atrial appendage to the right. So this is the right side of the heart, left side of the heart. And this atrial appendage appears more like a right atrial appendage. This is the superior caval vein for this atrium. And if you open that, you can see pectinate muscle here in this atrial appendage, very broad-based atrial appendage here. So this looks more like a right atrium. Okay, again the superior caval vein here, SVC, and we call the crista terminalis, or the terminal crest of the right atrium here. So again, this is the cavo-atrial junction, this is the SVC. Looking back here, the flap of the foramen valley here. And there is the coronary sinus. See the probe going into the coronary sinus here. Coming around to the posterior aspect of the heart, you can clearly see this is actually the left atrium here. This is the left atrial appendage. I'll put my probe in there and show you how distinct and finger-like and narrow-based this is. Again, the smooth appearance of the left atrial surface. And here, the pulmonary veins leading into the left atrium here. So actually these would be the left pulmonary veins here because I have everything around backwards. And back over here would be the right pulmonary veins draining in on the right lung. So I've flipped up the lungs and we're looking at the back of the heart. So the atria are arranged normally. You have right atrium on the patient's right, left atrium on the patient's left here from the front of the heart. So we looked at the atria. We want to look at the ventricles. And right away you see again, this right atrium empties into this ventricle, which is coarsely trabeculated, very heavily trabeculated. Now looking at the anterior part of the heart, here you have part of the moderator band. Here is the atrioventricular valve, most likely the tricuspid valve because there are attachments to the septum here. This is the separation between the tricuspid valve and the semilunar valve. This is the ventriculo-infundibular fold right here. Okay. Here's the septomarginal trabeculation. And looking at the semilunar valve, a little closer, there are the cusps, the semilunar valve there, and that leads to the lung. So that's a pulmonary artery. This is a left pulmonary artery. So this is most likely the main pulmonary artery here. And looking off this way, there is the right pulmonary artery. Right. So in looking at the septal surface of the right ventricle, you can actually see that there is a sizable defect here near the apex. And maybe another one there. This is actually just a muscle band here on the surface of the septum, but this is the ventricular septal defect. It's quite large. And this is the left ventricle. You can see there's smooth surface of the septum. There's the VSD leading to the right ventricle. Now looking up toward the outlet and inlet portion of the left ventricle, here is the outlet portion. This looks like it's leading to the aortic valve there. There's the aortic valve. Here, it's been cut open. And interestingly, there is no inlet portion. This is where the mitral valve would be in here. It looks like there's mitral valve atresia. So we turn around and we look back into the left atrium. And this is the left atrium here. And again, this is part of the foraminal flap here, septum primum, and there is no mitral valve. Can you get that to focus? There. No mitral valve in there. This is mitral valve atresia. So the posterior vessel is the aorta. It rises here. Very narrow here. Look at that. So this patient had coarctation of the aorta, very hypoplastic aortic arch. Here's the coarctation, right there, posterior indentation, posterior shelf. Here's the descending aorta. And if you note, this is the front. The aorta arises from the right and descends on the left of the trachea, which is the midline structure. What we have is atrioventricular concordance, normally related great arteries, mitral valve atresia, large muscular VSD, apical muscular VSD, leading to the aorta, which is hypoplastic in the ascending segment and significantly hypoplastic in the transverse arch with juxtaductal coarctation. And there's the ductus there. That is the ductus. It's a beautiful specimen from 1976. Very well preserved, very nicely dissected. Thank you.